giving you the inside track on local businesses. This is 13 Inside Track.
Welcome to 13 Inside Track. I'm Laura Steele, and we are coming to you from Spring Mill Meadows, part of American Senior Communities. And we are joined by two guests today, Troy Reef with AFC and Dr. Ben Field, who is part of a physician's discharge program, which is a new program with AFC. We're going to first start with you, Troy. Tell me your role at American Senior Communities.
Yes, I'm the Vice President of Post-Acute Service Development and Managed Care.
And tell me, why did ASC start this program, the Physician's Discharge Program?
Yeah, well, at American Senior Communities, we are committed to high-quality, safe care, not only in our skilled nursing facilities, but also when individuals go home. And what we have identified over the last several months is there's a gap sometimes when individuals are wanting to go home, but they don't have a primary care physician, or they haven't seen theirs for several years, and it is delaying and causing a gap in their care when they go home. So we identified that problem and put together a team like Dr. Ben Field and others around the state of Indiana to support and allow those individuals to be seen timelier when they get home.
And now we're joined by Dr. Ben Field, who is a physician involved with this program with ASC. Tell me, what takes place if someone is ready to go home, a patient's ready to go home, and once they are there?
And what we do initially is we come into the facility and gather some information so that we can coordinate some of the care for the resident, so when they get home, they have all the things that they're going to need once they're there. Then, once they are home, we'll come out to their home and provide primary care. We're a home-based primary care practice who will provide medical care to them in their own home.
And tell me about the doctors and the hospitals. How are they reacting to this new program?
Yeah, well, the feedback has been tremendous by our hospital partners and physician groups around the state of Indiana, because ultimately those individuals start under their care and transition to our skilled nursing facility, and then we transition them home safely. So they've been really appreciative of us starting this program with tremendous outcomes for their members.
What if they need a higher level of care, if these patients are requiring that?
Well, they have basically three different options. So in order to try to keep them at home, we will get a home health care agency involved in their care. If they can't stay at home, we would want them to go back to the ASC senior community from whence they were discharged. And the third option is for them to go into an acute care hospital, which is really the last option.
And I have to know about the outcomes. Tell me about them.
Yeah, well, we track a lot of outcomes from readmission rates to ER visits, et cetera, but the biggest outcome has really been the individual stories that we've heard and the feedback from the individuals and their family members on the great support this has lent them. Because a lot of people, when they discharge from us, they're still homebound, and they're still recovering from their initial illness. And it's really been a tremendous benefit, and that's really the commitment that American Senior Communities is bringing to their communities.
Thank you, gentlemen, so much for joining us today on 13 Inside Track. And if you'd like to see your business featured on 13 Inside Track, all you have to do is email us at 13insidetrack@WTHR.com.